Welcome to Sport Rehab Playbook. Bunions, otherwise known as Hallux Valgus, are a deformity of the big toe that can cause pain along the inside of the joint with walking, running, or wearing tight shoes. In this video, we will review a taping technique that may help provide relief to this condition. You'll need adhesive spray applied to anchor zones, an adhesive elastic tape, typically 2 to 3 inches wide, such as Surelite, and a narrow, rigid tape, usually 1/2 to 3/4 of an inch wide, such as zinc oxide. Position the patient supine with the foot relaxed. Apply a circumferential anchor of adhesive elastic tape around the midfoot. Apply a second anchor of narrow, rigid tape around the proximal portion of the big toe. Measure and apply a narrow strip of rigid tape from the distal anchor to the midfoot anchor, applying a medial pull to the great toe as the strip is laid down. These strips are designed to gently pull the big toe medially, helping counter the hallux valgus position and reduce discomfort at the joint. Apply 2 additional strips in the same manner as earlier at slightly different angles, as shown here. Additional strips may be added if greater corrective force is desired. Once all strips are laid down, close down the distal anchor circumferentially with rigid tape. Before closing the proximal anchor, reassess the alignment of the big toe. If more correction is needed, further tension the strips while guiding the big toe inward. Once adequate correction is achieved, close down the proximal anchor. Lastly, secure and close any exposed tape edges. This technique applies a medial corrective force at the first metatarsophalangeal joint, encouraging the big toe toward a more neutral alignment and potentially reducing stress along the medial prominence. It may provide temporary symptom relief for individuals with hallux valgus, commonly referred to as a bunion. Thanks for watching, and I'll see you in the next video.